There's on demand for so many things in our world, so why not for medical care and for things that are your non-emergency conditions? And that's what my next guest is here to talk to us about. So good to see you, Dr. Fahad Tahir with St. Thomas Medical Partners. Nice to see you today.
Nice to see you too. Thank you for having me.
Sure. I know this sort of came about. You talked about your wife being sick at an airport, and you kind of stumbled on to this kind of service, and we know it's grown in its application as technology has gotten better as well. Tell us about how you're using it at St. Thomas.
Exactly, that's exactly right. My wife was we were in an airport on a Friday night. My wife wanted to get access to immediate care, and it was a Friday night. She didn't want to keep, feeling sick all weekend. And so we immediately said, what are our options? What's immediately available to us? And we saw this technology that was available in another city, and we thought, why can't it be here in Nashville? And so as part of our mission at St. Thomas to enhance access to health and well-being, want to make it convenient for patients in our growing community, we thought, we know we've added all these locations across Middle Tennessee at St. Thomas, but why not go this extra step of creating this added access, this added convenience of having virtual care available, a great clinician, a physician or advanced practitioner available right on your phone or on your mobile device, so you can see a clinician just like you can access all other parts of your life through technology. And the technology's improved incredibly, just like our phones have improved over the last 10 years.
With the cameras, as you said, with better cameras that can see so much and very clear images. So what kind of ailments are best suited for virtual care?
Sure. Well, anything that would be it allergies, sinus, ear aches, things that you would go to a walk-in clinic for or an urgent care for. No broken bones, no chest pain, but really the things that you'd want to go in for when you're really just not feeling well and you need a caregiver to help you feel better.
I see, like even rashes, dermatitis, upper respiratory, even a urinary tract infection?
Sure, yeah. I think what we do is create clinical protocols with the help of our physicians who see our patients in the exam rooms of our practices to ensure that we have great guidelines that can be followed in a virtual environment.
Okay. How is it going so far? Are you getting a lot of use or a lot of people participating in this?
We interviewed thousands of patients, and what would create the kind of access and convenience that feels right? And patients ask for two things. Don't make me fight traffic to drive all the way into town for a simple doctor's visit and then wait in the waiting room. And so we said, let's bring our clinic locations, our care centers into the community, and then let's go this extra step and offer virtual care. So wonderful physicians, advanced practitioners licensed here in Tennessee can provide care for all of these simple ailments to avoid having to fight traffic and go into a care location.
Is virtual care, is this a safe alternative for patients out there to being in front of someone, in person, one-on-one in a medical setting? It is safe?
Absolutely. We've clinical guidelines created by board-certified physicians, and now this is being practiced in all 50 states across the country. We're glad at St. Thomas to be the first in the state of Tennessee to bring this service to the community.
You are the first.
We are, and we're excited about that. But we've seen this across the country, and the federal government's looking at how do we enhance our federal health care policies to use virtual care to enhance access, because there's a lot of communities, as we know, particularly the rural communities, where there's very limited access to physicians and caregivers. So we constantly ask ourselves, if we really take responsibility to manage the total health and well-being of the families in Middle Tennessee, how do we do that? And sometimes it's by adding care centers and locations closer to people's homes, but in other cases, virtual care can really enhance that access for folks.
I'm sure there's a bit of a learning curve, especially maybe with some of the older population that's not as familiar maybe with a smartphone or iPad or whatever their device is. Are you teaching them how to use that to set things up so that you can get a really clear image of what you maybe need to see? How to communicate back and forth?
We give patients the option. Sometimes a phone conversation is adequate depending on what the visit's need is, and in other cases a face-to-face visit is more critical. But I got to tell you, those smartphones, everyone's got them these days.
It's true.
And so it's incredible how comfortable all ages are with this kind of smart technology. And because we use it in other aspects of our life, healthcare is actually not the first time that our grandparents and parents are starting to use it.
That's true. That's true. In what instances would the virtual visits not be appropriate?
You know, that's a great question. We are really thoughtful about making sure patients are in the right care setting for their needs. So if you have chest pain, we've got to take you to an emergency room. If you have a broken bone, if you're bleeding, those situations aren't best addressed in virtual care. That's best addressed in an in-person setting, maybe an urgent care setting. So we're really sensitive to making sure patients get to the right destination for their care. So if a patient reaches out for virtual care and they're better served somewhere else, we won't charge them. We'll go ahead and take the patient directly to the appropriate care setting and direct them appropriately.
I saw on our list, I don't know if they could pop that up on the screen again, where it listed different things that would not be appropriate for a virtual visit. There it is again. It said even like dizziness, loss of consciousness, and suicidal thoughts. So any kind of emergency mental health crisis would certainly not be best served by the virtual care. Okay, so what is the cost associated with this? Does it vary from virtual visit to virtual visit?
No, we keep it very simple. We asked our patients, how do we make this simple, convenient, easy to access for you? And what patients said is, we don't want a complicated menu. Just tell us what it costs. And it costs $49.
$49, okay.
Exactly. So the idea was, how do we make it cost effective and accessible for all populations to afford, and cheaper than an emergency room copay on average, which is more than $49.
Absolutely. So to get more information about this for people who are watching and want to do this.
Yes, stthomasdoctors.com, easy to access. You can see a menu of locations close to people's homes, as well as directly get medical care right there on the web by see a clinician right now.
Okay, and finally, the most common thing you're diagnosing is, can you say, is it?
Allergies are very common, and sinus.
Okay, well that makes sense. And living in Middle Tennessee, you're bound to be affected by one of those.
And you can guess this time of year, it's very busy.
Absolutely. All right, Dr. Tahir, thank you very much.
Thank you very much.
Okay, take care.